It is important for SAS doctors to be involved in leadership roles. SAS doctors are senior doctors. They're on the shop floor. They know what's happening. They know how they could change to make things better for the NHS. They provide stability to services. I think they would bring a wonderful new, fresh look at leadership. Obviously, this would benefit trusts and patients because things would get better. They would get solutions that they haven't had before, particularly because they come from the grassroots. It has been hard for SAS doctors to get into leadership roles. It's been hard because sometimes there is no recognition that they're senior doctors. Traditionally, their voice hasn't been heard, but things are changing now. We're seeing people choosing this to be a career and choosing this career because there's other things they can do with the career. I am an associate specialist in ENT, and when I first started looking at developing myself, I did a course on how to become an educational supervisor. I applied for a role as an educational supervisor, and soon I had 3 trainees, and that's the beginning. There were other people who applied. The issue is, if you don't apply, you're never going to get it. So if you apply, if you get rejected, you're still learning, because the interview itself teaches you and makes you stronger for the next time you apply. So I would say, keep applying, build on your strengths. You are the backbone of the NHS. This is not something that I said, but by a chief executive of NHS England. The difference you make to patients is enormous. And once you get into the leadership ability, you'll realize that the powers that be would listen to people who are hands-on, reasonable, and bring in a new skill set of leadership. It makes a huge difference. I hope that after SAS week, leadership will become a huge theme for SAS doctors going forward this year.